Good afternoon and welcome. It is my pleasure to welcome you to Lessons Learned from COVID-19, Preparing for a Future Pandemic. My name is David Wyman. I'm the interim president of the Rogosin Institute, and it's my pleasure to welcome all of you here this afternoon. I want to thank you for spending the next few hours with us. We have a wonderful group of individuals joining us this afternoon. Over 320 individuals have registered for this virtual symposium. This is our 9th annual symposium. Obviously this year with COVID-19, it is a virtual symposium. We have representation from an esteemed group of healthcare systems, agencies, and organizations, not just in New York and in the Northeast, but across the entire nation. I'd like to spend just a minute or two talking about COVID-19 and some of the topics and subjects that will be covered this afternoon. Certainly, living and working through a pandemic is obviously a very trying time, not only for us as caregivers and healthcare workers, but also for our patients. So talking about that, talking about crisis and leadership during crisis will be one of the themes that will be discussed today. We all deal with those situations and scenarios differently, and I think there's a lot that can be learned in stories shared. Certainly for our patients in the complexities of COVID-19 and dialysis in general, and the different modalities and therapies were impacted differently by COVID-19, so that will also be discussed, as well as from the perspective of healthcare workers and loved ones and caregivers, as well as from a patient perspective. And to lay on top of that some of the current events, not only of COVID-19, but of the complexities of systemic racism, socioeconomic backgrounds and demographics, and how that plays into the patient experience, what patients may be exposed to, and really what we can all learn from each other to overcome some of those complexities. So again, it is my pleasure to welcome all of you and to thank you for joining us this afternoon. And it is my pleasure to introduce Dr. Jeffrey Silberzweig, Rogosin's Chief Medical Officer.
None of our speakers has any conflict of interest today. All questions will be answered during the Q&A panel discussion at the end rather than after each individual speaker. We will get to as many questions as possible. Diane Morris, our Chief Nursing and Clinical Officer, will be monitoring the Q&A panel in the chat box. So if you please submit your questions there, we will ask as many of them as we can at the end of the presentations. Only the host and the panelists can see your questions, so your questions are not going to be visible to everybody involved viewing the seminar. Before I touch on the overview and goals of the symposium, I want to thank the people who really helped to put this program together. Our development office, led by Susan Spiegel and Tanya Citrone, as well as Nilufa Bilgum, and our information technology department, led by Dan Levine, as well as Travis Lovis and their entire group. Today's symposium, as David touched on, will be directed at learning what we can from the events of the past 6 months and how we can take those lessons and move them forward to best treat our patients, but also to manage the complexities of our medical staffs. And truly, this week, we're celebrating the real heroes of this pandemic, since it is National Nephrology Nurses Week, and it's also National Technology or Patient Care Technicians Week. So we thank all of them, as well as all of the physicians and all of the many other staff who were critical to helping us get through the COVID epidemic and to care for all of our patients throughout that period of time.